Well, I'm getting up there in years. I can't believe I'm this old, actually. But here I am at 77, almost 78. And I've had a pretty full life. I was a lawyer. I had a son that I adopted as a single parent. And then I got married. And I lost my first husband to cancer. My second husband was somebody I've known since I was 15 years old. And we have a wonderful relationship. And he's been a wonderful companion in this journey with multiple myeloma. Even though I'd had some experience before with cancer, it still came as a terrible shock when I was told I had it. But I was told in the emergency room that I had cancer. And I, I just wanted to press the reset button and have this not happen. But of course, that's not one of the possibilities. But I left a message for my primary care doctor, who was, it turns out, about to tell me the same thing. But he called me that evening after a long day of seeing patients, about 8 o'clock in the evening. And he said, "You have multiple myeloma and it's treatable." And I have patients who've lived for 10 and 20 years with this disease. Well, I felt a lot better. It didn't relieve all of the bad feelings about having a cancer diagnosis, but it certainly made me feel better than what the first doctor had said. The first attending doctor had wanted to give me a prescription for physical therapy and send me home. And I said no. It wasn't fair to the physical therapist to have to figure out what the problem was. So she left the room and she sent a younger doctor in after a while. And that younger doctor said I had two choices. One is this option that I'd already refused, and the other was to have a CT scan. And I said, I'll take that one. Well, meanwhile, the shift changed. New doctors came on, and the next attending physician came in and told me I had cancer. This is another female attending physician in the emergency room. In the middle of the night, then I went home with my husband, of course, and left a message for my primary care physician. Well, it was a terrible feeling. We were both devastated. I'd never even heard of this disease. My husband had, oddly enough. His father had had it. I hadn't known that. Well, this was a little over 10 years ago. And I'm still doing okay. I keep having new treatments. They only last for a fairly short time with me. If it's a good treatment, it lasts. And if it's not such a good treatment, it might not even last that long. Oh, they call it VRD. It's a pretty common first treatment. I think they're starting to change the usual first treatment a little bit. But for a long time, that was the first treatment almost everyone got, unless you had a terrible reaction to one of the treatment drugs. You had Velcade, Revlimid, and dexamethasone. And that went on for several months. But that very first day when my primary care physician told me that it was treatable, it really made a difference in how I felt about it. It wasn't nearly as scary. I accepted what he said and felt a lot better. There were a couple of clinical trials near the beginning that only lasted a month or two, and he took me off them because they weren't benefiting me. I know there's some misconceptions that a lot of people have, especially misconceptions that you don't know whether you're going to get the drug. And in phase and phase 2 trials, you do know you get the drug. It's only later when there are when the drug has passed certain milestones that that there are people who don't know whether they're getting the actual drug. But I've never participated in a trial like that. I've only had phase 1 and phase 2 trials, and I know I'm getting the drug that's been described to me. On more than one occasion, when it came time that I needed another treatment because the one I had been taking had stopped working, Dr. Martin would explain to me what the options were. And perhaps there were 3 different treatments that he could choose among for treating me. So we'd have a meeting. He'd explain to me what these possibilities are. And typically I would, if I didn't already have a pretty good idea of what I wanted, I would ask him which one he really preferred for me. And he'd tell me which one he thought was best. And I'd usually go with his recommendation. But he wouldn't really insist on it. He would explain what the options are. And he'd only tell me his preference when I ask him. Efficacy is, of course, very important. Sometimes side effects affect my preference, but not often. And usually I don't even know how those side effects are going to feel until I experience them. One of my other health issues are GI issues, gastrointestinal. If a treatment is going to affect gastrointestinal issues, I want to know about it, evaluate how that affects my choice. It won't necessarily prevent me from entering into that trial, but it'll be a consideration. And side effects can be relatively minor or they can be major. And there have been occasions when late at night, my husband puts me in the car and takes me to the emergency department. And it's, very good to be able to do that and to be really near where you can not only get help, but you can go to, I can go to a hospital that has all of my records and access to the information that a doctor would need in order to deal with whatever the problem is. That's just really important. At the time, it was called the Seattle Cancer Care Alliance. The same place is now called Fred Hutchinson, but they arrange housing for you. And they have a shuttle that takes you to the clinic and to the Safeway store. And I went up there to start alone and didn't think I needed a caregiver right away. And they told me one day that I needed a caregiver for a particular test that I was having to undergo. Well, I was living in this building with all these other myeloma patients and other cancer patients. And they didn't have anything to do except to go to the clinic. So there were lots of people who volunteered to help me with that particular day. And then eventually my husband had to come. And I spent 2.5 months in Seattle for this. He was there for maybe 2 months. I'm not sure exactly. Well, they always send you a copy of the paperwork before you decide for sure that you're going to join the clinical trial. So you have a chance to look it over. And I know that some people might find it daunting, But one of the things they have in that uh, consent form is a list of the possible side effects. And you can read all about it and ask questions of the doctor before you sign it. So I know where to look for all this stuff, and I go straight to it and I ask questions about it. But that's I think it's pretty easy to understand. It's surrounded by a lot of other words. But if you find the possible side effects, that's what you want to look at and ask questions about. And you want to know something about the experience of other people who've been in this clinical trial. In Seattle, I remember they told me that one of the participants had died. And so I wanted to know about her health. And I decided, after they explained it all to me, that I was considerably healthier than the patient who had died. And it was going to be okay. Well, my insurance paid for just about everything that the trial didn't pay for. Okay. The sponsor will pay for anything that's new. Your regular insurance will pay for some other things that have to be done anyway. The most expensive thing, though, was travel to Seattle and housing in Seattle. I had to pay for that. So you should just always ask. The great thing about CAR T, if it really works for you, is that it's what they say, one and done. Once you've had the treatment, you don't need treatment again for a while. Now, like a lot of us, the treatment doesn't last forever, but it lasts a while, and you don't have to keep coming back for additional infusions or anything like that. If it works, it's great. Now, my first CAR T didn't work that well for me, and we're not entirely sure why, but it brought my numbers down. It just didn't bring them down enough, and I still needed treatment. One theory is that because I'd had bendamustine before, that might have made it difficult for the CAR T to work. I don't think anybody really knows if that's the answer. They take the T cells out of your body and they run your blood through this contraption, which has a centrifuge so that they can separate the T cells from other parts of your blood and take out the T cells and give the rest of it back to you. And in order to do that, they put this giant thing in your neck to get the blood out. And that's just sort of annoying, but it's not terrible. So that's one of the first steps in the process. And then you might get some treatment or not between the time you get your T cells removed and then you get them back after they've been re-engineered. And then they put the re-engineered T cells back into you and look for the side effects, neurotoxicity and CRS, which we all begin to learn means cytokine release syndrome. And my second CAR T, I had a very strong reaction, and I had a day when I was completely out of it. They tell me I couldn't answer simple questions like, what is your name? And I don't remember a thing from that day. Uh, I understand that all of my organs were affected. They were afraid that um, I'd had a heart attack of some sort, but I didn't. My heart is fine. It recovered completely. But it was a very strong reaction, and it worked. Well, the CAR T is it's over so quickly compared to the other things that it's really nice. Um, Now, I did have a problem that showed up right after the treatment. I started needing transfusions, and apparently, I got a an infection of parvovirus, which doesn't affect most people, but it caused me to need transfusions. So I had to get infusions of IVIG, and that takes care of the problem, but it complicates our ability to measure how well I'm doing. Myeloma is IgG kappa. So if you put a lot of IgG into my body, it looks like there's there's more cancer, but there isn't. It's not cancer. Yeah, so it took a little longer to figure out that it worked as well as it did, but it did work. We were just wondering for a little while how well it had worked. Like most patients, I get checked regularly. So it's not a big surprise when a treatment stops working. And so I began, as usual, to see the numbers start to creep up. And uh, when my M protein reaches 1.0, it looks like another treatment is under consideration. Or even before that, we start thinking about it. But when I get to 1.0, I'm probably going to be on another treatment soon. And then the second one was talquetamab, which hasn't been approved yet, but that's the one I did after teclistamab. I remember talquetamab better because it was problematic. Some of the side effects of talquetamab were really annoying. The target molecule was something that's not just found on myeloma cells, it's also found on fingernails and toenails and on the tongue. Your fingernails get funny. Some people lose them altogether. And food doesn't taste the same. That was pretty annoying. Well, the fingernails weren't so terrible. Actually, the palms of my hands and the bottom of my feet also got a kind of red and peeling. That's really not so terrible. Uh, and I only lost a part of my fingernails and toenails. Um, but the taste buds, that was really something that affected my everyday life because there were things that just didn't taste right. Uh, for example, blueberries and pears, which are kind of bland tasting fruits, tasted salty to me. Now, it didn't affect everybody the same way, but I couldn't stand eating blueberries and pears. And I was kind of touchy about hot spices. I didn't really like anything spicy during that period because it was very harsh. So it affected what I would be willing to eat. And, that's really an important part of your life is what you eat. Well, it was very unpleasant. And, I really didn't like it, but it didn't cause me to stop the treatment. I persisted anyway. I was just annoyed all the time. Now, other people, I'm told, um, had different changes to their taste buds. Uh, some people liked having hot foods and wanted them all the time. So my taste bud changes weren't necessarily the same as anybody else's, but they had taste bud changes. Oh, I think bispecifics are a very good choice, especially if you can get them at your home medical center. And there's some new ones coming out that I haven't tried yet. I'm curious about, but I haven't had a chance to try them yet. I mean, it was interesting because my numbers have stayed down for so long, even without treatment. Um, because at first he only took me off selinexor, but I was also taking another drug with it at the same time. And he took me off that too. So I haven't had any treatment since November 1st. Um, so it's been nice. And I'm told that my antibodies are good. Um, so I don't feel like I'm in danger every time I walk out the door. Um, so yeah, it's been fine. It's just a nice holiday. I know it's not going to last, and that's okay. But it's just a nice thing to be able to do, and to be able to do it at a time when um, I'm not too worried about COVID because my antibodies are good. Um, I don't want to get it. I've had it once, but I feel like I can just enjoy a holiday. Well, because my antibodies are good, I do feel some freedom that I didn't have for a while. And getting myeloma treatments usually means that there'll be a problem with antibodies again, a problem with white cells. Um, I'll have to be more careful. A lot of people have given up masks. I'm not talking about myeloma patients. I mean, just people in the neighborhood. And they think it's a little odd when people continue to use them. But I just do what I need to do. Um, but I do feel a lot freer to walk around without one nowadays. And I know when I start treatment again, I'm going to have to be careful again. That's okay. I'm satisfied with how my life is going. I've gotten to know some people that I like very much in this journey. It's a very important part of my life now. I have a lot of friends in this community, people I meet when we have a support group meeting. These are people I keep up with, and we might not go out to dinner together, but I feel like I really know them and care about them.